Hello, I'm Matthew Weinstock with Hospitals and Health Networks. Thanks for tuning into our Executive Insight series. HNHN's December cover story is a profile of Dr. Jonathan Perlin, the incoming Chair-Elect of the American Hospital Association. Dr. Perlin is uniquely qualified to be moving into a leadership role with the AHA as the healthcare landscape continues to get reshaped. During the late 1990s and early 2000s, Perlin led an effort to transform the then ailing Veterans Health Administration. He was instrumental in forcing the agency to adopt a higher standard of care, and as a true believer in health IT, he ushered in an era of digital health at the integrated delivery system. Currently, Dr. Perlin serves as President of Clinical and Physician Services and Chief Medical Officer at HCA, the nation's largest for-profit health system. At HCA, Perlin has championed efforts to reduce healthcare-acquired infections, advance health IT, and improve quality benchmarks across a diverse portfolio of hospitals. Perlin's desire to champion healthcare improvement was forged at a young age as he watched his dad bring mental health services out of the hospital and into the community in 1960s Baltimore. Since then, Perlin has firmly believed that healthcare providers can and should play an important role in bringing about real social change.
Health is a prerequisite to almost everything else in life. The Constitution guarantees life, liberty, and the pursuit of happiness, but you really need to have health to be able to enjoy the opportunities of a society. And we in the field need to assure that individuals and communities can achieve their highest levels of health and function and capacity. And in fact, that's what's so compelling about the American Hospital Association mission, which is a collective commitment to elevating the health of individuals and communities.
Perlin is a staunch proponent of health IT. He sees it as a powerful tool for improving care delivery. He serves as chair of the Federal Policy Committee advising the Department of Health and Human Services on health IT standards.
Electronic health records and associated information technologies aren't an end in and of themselves. They're really tools to improving care. In the Veterans Health Administration, we're able to effect a transformation from a sick care to a healthcare system, but a lot of that involved not only bringing technologies to connect care teams within the hospital, but connecting patients across their experience of care, be it an ambulatory care clinic or even in their home. It's really exciting right now with the development of standards, with the implementation of electronic health records. Not only are we increasingly accelerating the ability for care teams and hospitals and formal care settings to work more effectively, but and also inform the patient's experience across time and across geography. But when you think about what's possible in terms of maintaining health and improving and preserving function and independence, it's really exciting. Imagine a scenario where a heart failure patient is followed by a doctor or a hospital, and she is followed at periodic intervals but comes back unexpectedly because she's had a deterioration in function and shows up in the emergency room and fluid overload. Well, now contrast to that to a different scenario. Imagine an opportunity where a patient might be wearing a Fitbit like this one on my wrist. And if I've changed as a doctor the patient's medication and in fact their function is going up, know that things are going well. If on the other hand the Fitbit data is fed into the health system and we see that the patient's activity level has plummeted, then maybe we can avoid an emergency visit to the emergency department, but instead intervene with a phone call and help to rescue that patient before a catastrophe. This is why electronic health records and health technologies are exciting.
When we talked in his office in Nashville this fall, Perlin also discussed the challenges and opportunities the field faces in moving from a sick care system to a healthcare system.
I envision a future where clinical integration really means that we connect the ability to provide the world's best sick care with the best opportunities to promote health and prevent disease. We're struggling because the historical business models have really been for sick care, and I think one of the terrific opportunities for AHA is to help to articulate to our policymakers and legislators a business case that allows us to shift weight from the traditional system to a future system and create a business case that makes sense and allows bringing everyone together. One other element of clinical integration is really the increasing collaboration of healthcare institutions and healthcare providers, especially doctors, for example. We've tended to do a lot of terrific work in parallel. The future really requires that we work together. I'm pretty excited about being a physician going into this opportunity, this great privilege of leading the AHA as chair, and hope that can help to bring together clinical colleagues, administrative colleagues, to really realizing the aspirations for better health, better disease promotion, better coordination, and of course, better sick care when necessary.
Lastly, Perlin sees the AHA playing a vital role, bringing together a diverse group of organizations and a diverse set of opinions to seek common ground on some of today's most complicated healthcare issues.
The American Hospital Association is a terrific convening organization. We're facing some critical challenges in healthcare in the United States, but these are also incredible opportunities if we take advantage of the moment. I think the AHA has the opportunity to convene a broad cross-section. I personally hope we can accelerate our appreciation and valuing of diversity and collect the best of intellectual capital across a range of circumstances and help translate that into advocacy for policymakers and legislators that helps us all reach the highest aspirations of the AHA goal, improving the health of individuals and communities.
For more of my interview with Dr. Perlin, be sure to check out the December issue of HNHN. I'm Matthew Weinstock. Thanks for tuning in. And from everyone at HNHN Daily, have a happy holiday season.